Hello, hi, welcome to the channel Health Alerts. Today is the 2nd of June 2023, and today I'll be talking on a topic or on a subject which is, nowadays a household name. People around the globe and in India, of course, are exponentially facing the threat from the ailment called diabetes. Now, diabetes is a very common name, and crores of people are suffering from this ailment, and everybody has some bit of knowledge about diabetes, what are the medications, how it is to be managed. But today I'll be talking something different on diabetes, which will be absolutely different in the term that I'll be highlighting on the root cause of diabetes. What is the root cause? Before that, a well-informed person is more likely to survive longer and have a better quality of life than uninformed ones. So having basic knowledge of about the disease is always will be helpful for everybody to seek the correct guidance from doctors, from medical institutions, or from other medical associates. So today, as I said, I'll be talking regarding diabetes mellitus and the root cause. The name of the disease, in short, is called diabetes, but actually in medical terminology, it is called diabetes mellitus. Now, diabetes, as we all know, is a chronic health condition that affects how your body turns food into energy. Your body breaks down most of the food you eat into sugar, what is called glucose, and releases it into the bloodstream. Now, when your blood sugar goes up, it signals your pancreas to release insulin. Now, this is the most important part of this discussion. Pancreas, insulin resistance, and the allied things, which are the root cause of for the cause of diabetes, is the most important part of this presentation. So, to repeat, when your blood sugar goes up, it signals your pancreas to release insulin. Pancreas is an organ in our body. Insulin is an hormone which is being released by pancreas, and that hormone insulin actually regulates the sugar level or the glucose level in our body and transports it to our cells for conversion into energy so that we remain active. Insulin acts like a key to letting the blood sugar into your body cells for use as energy. As I said, with diabetes, actually your body doesn't make enough insulin or can't use it as well as it should. The difference, there are 2 points. Either your body can't make insulin or the body can make the insulin but can't use it as well as it should. There is a difference between these 2 points. When there is not enough insulin or cells stop responding to insulin, too much blood sugar stays in your bloodstream. Means when uh, the cells stop responding to insulin, there will be accumulation of blood sugar in your bloodstream because they will not be converted by the cell to energy. Over time, that can cause serious health problems such as heart disease, vision loss, and kidney diseases. Now, the role of pancreas in diabetes. The main function of the pancreas, an organ, is to maintain healthy blood sugar levels. It's a large gland located behind the stomach. It produces insulin, glucagon, and other hormones. Diabetes occurs when the pancreas doesn't produce enough insulin or when the body doesn't use insulin properly. In the medical terminology, it is called insulin resistance. Just once again, I would repeat so that it lingers in your mind. Diabetes occurs when pancreas does not produce enough insulin or when the body doesn't use the insulin properly. So that's what is called insulin resistance. The pancreas and the insulin. Continuing, the pancreas is an organ located behind the lower part of the stomach, in front of the spine, and plays an important part in diabetes. The pancreas is responsible for producing insulin. So it is clear now that insulin is produced by the pancreas. The cells which produce insulin are called beta cells. Now, beta cells are located or embedded in the pancreas. So, in the pancreas, the beta cell produces insulin. These cells are distributed in a cluster of cells in the pancreas called islets of Langerhans. Now, once again, please, this is to be emphasized that pancreas is responsible for producing insulin. In the pancreas, beta cells are embedded, which actually produces the insulin. Now, insulin is a hormone that helps to regulate blood sugar level by assisting the transport of glucose from blood into neighboring cells. So, actually, insulin transports the blood sugar from the bloodstream to the cells, gets it converted into energy for that, so that we remain active. Now, what are the types of diabetes? There are three main types of diabetes: type 1, type 2, and gestational diabetes. Gestational diabetes is diabetes while a woman is pregnant. That is a temporary diabetes. Type 1 diabetes, what it is and how it is defined. Type 1 diabetes is thought to be caused by autoimmune reaction. Now, this is another technical term, autoimmune. What is autoimmune? Autoimmune actually, when your body starts or becomes allergic to its own body, to its own parts, and starts attacking and killing. Like, the body attacks itself by mistake. Your body becomes allergic to some part of your body, and thus it starts attacking those parts and killing those parts. That is autoimmune. Now, there are different kind of autoimmune disease. For example, rheumatoid arthritis, and there are many other autoimmune diseases. Now, as more beta cells get killed off, why beta cells are getting killed off? Because of the autoimmune reaction. And beta cells, I'll recollect once again for you, is embedded in the pancreas. So as more beta cells get killed off, the pancreas struggles to produce enough insulin to keep blood sugar level down, and the symptoms of diabetes begin to appear. Hope this is clear to you. This reaction stops your body from making insulin. Approximately 5 to 10% of people with diabetes have type 1 diabetes. Symptoms of type 1 diabetes often develop quickly. If it's usually diagnosed in children, teens, and young adults. If you have type 1 diabetes, you will need to take insulin every day to survive actually. Currently, unfortunately, no one knows how to prevent type 1 diabetes. Now coming to type 2 diabetes, the second type. With type 2 diabetes, your body doesn't use insulin well and can't keep blood sugar at normal levels. Here, the body is producing insulin but may not be in a sufficient level, and it cannot keep blood sugar at normal levels. In type 2 diabetes, the body builds up resistance to insulin, and more insulin is needed to bring down blood glucose level. As a result, the pancreas needs to produce more insulin than it would normally need to. Further development of type 2 diabetes can lead to the loss of insulin producing beta cells from the pancreas, leading to the need for insulin to be administered or injected. So development of type 2 diabetes can lead to the loss of insulin producing beta cells, which are embedded, as I repeatedly mentioned, in the pancreas, leading to the need for insulin to be administered. About 90 to 95% of people who have diabetes of type 2. It develops over many years and is usually diagnosed in adults, but more and more in children, teens, and young adults also. You may not notice any symptoms very quickly. So it's important to get your blood sugar tested if you are at risk. Type 2 diabetes can be prevented or delayed with healthy lifestyle changes such as losing weight, eating healthy food, being active. What is gestational diabetes? As I said, gestational diabetes develops in pregnant women who never had diabetes actually. It is during their pregnancy that they develop this kind of diabetes, known as gestational diabetes. If you have gestational diabetes, your baby could be at higher risk for health problems. Gestational diabetes usually goes away after your baby is born. So it normally goes away after the birth of the child. However, it increases your risk for type 2 diabetes later in life. Your baby is more likely to have obesity as a child and or teen and develop type 2 diabetes later in life. Now comes pre-diabetes. So as the name is suggestive, with pre-diabetes, blood sugar levels are higher than normal, but not high enough for a type 2 diabetes diagnosis. So here the blood sugar level is in between the normal blood sugar level and defined type 2 diabetes blood sugar level. So you are in between those two levels, and has such condition is known as pre-diabetes. You will be declared as pre-diabetic. Pre-diabetes raises your risk for type 2 diabetes because you are approaching type 2 diabetes and heart disease and stroke. Now, the connection between vitamin D and diabetes. The D angle of diabetes, as the caption was for my this presentation. Renewed interest in vitamin D, the so-called sunshine vitamin, has occurred recently because it has been linked to everything from cancer and heart disease to diabetes. Research studies shown or continue to pour into the literature stating that vitamin D is a superstar vitamin when it comes to health. Many studies have looked at the role of vitamin D in diabetes and have shown an association between low level of vitamin D and increased risk for type 2 diabetes and its complications. It's crystal clear that low level of vitamin D and increased risk for type 2 diabetes and its complications. There is an association. And what's concerning is that low level of vitamin D, also dubbed as sunshine vitamin. Why sunshine vitamin? Because vitamin D can be achieved from sunshine, from sun rays. So what is concerning is that low level of vitamin D, dubbed as sunshine vitamin, are all too common, especially among older adults and people of certain ethnic and racial groups. The relationship between vitamin D and diabetes. How vitamin D helps your body use insulin. Researchers found that the chance of developing insulin resistance went down with each additional amount of vitamin D supplement taken. Now try to understand this very important line. Chances of developing insulin resistance went down with each additional amount of vitamin D supplement. So when you have proper vitamin D level, or if you don't have the proper vitamin D level but you are getting supplementation, then the insulin resistance part can go down. The researchers say this might indicate that vitamin D3 is a protective factor in the occurrence of insulin resistance because it helps lower inflammation, and inflammation raises your risk for insulin resistance. More studies are needed to understand the relationship between vitamin D and insulin activity and whether it's different for certain group of patients. This is a pictorial representation of vitamin D deficiency impacts. Vitamin D deficiency can lead to metabolic syndrome, can lead to obesity, can lead to insulin resistance, hyperlipidemia, diabetes, hypertension. Vitamin D is characterized as a regulator of homeostasis, that is changes of bone and mineral metabolism. Vitamin D may play an important role in modifying the risk of cardiometabolic outcomes, including diabetes mellitus, hypertension, and cardiovascular diseases. Role of vitamin D in insulin resistance. The incidence of type 2 diabetes mellitus is increasing worldwide and results from a lack of insulin or inadequate insulin secretion following increases in insulin resistance. Therefore, it has been proposed that vitamin D deficiency plays an important role in insulin resistance resulting in diabetes. I repeat, vitamin D deficiency plays an important role in insulin resistance resulting in diabetes. The potential role of vitamin D deficiency in insulin resistance has been proposed to be associated with inherited gene polymorphism, including vitamin D binding protein, vitamin D receptor, and vitamin D1 alpha hydroxylase gene. Now, these can be some technical terms which everybody need not be aware of. But the overall point here is that the importance of vitamin D deficiency can be one reason or the root reason for the development of diabetes. Role of vitamin D in insulin resistance. The incidence of type 2 diabetes mellitus is increasing at an alarming rate both nationally and worldwide. Defects in pancreatic beta cell function, insulin sensitivity, and systemic inflammation all contribute to the development of type 2 diabetes mellitus. See, this is a repetition. defects in pancreatic beta cell function. As I was mentioning, beta cells are embedded in the pancreas, and beta cell in the pancreas produces the insulin. So insulin sensitivity and systemic inflammation all contribute to the development of type 2 diabetic mellitus. Since insulin resistance is a risk factor for diabetes, understanding the role of various nutritional and other modifiable risk factors that may contribute to the pathogenesis of diabetes is important. Obesity and other lifestyle factors such as exercise, alcohol consumption, smoking, and certain dietary habits can also play an important role. Recently, a novel association between insulin resistance and vitamin D deficiency has been proposed. Vitamin D has in vitro and in vivo effects, means in the body as well as in the lab, on pancreatic beta cells and insulin sensitivity. This is a clear-cut statement. Vitamin D has in vitro and in vivo, means in the body, in the system, in reality, and in the lab also, effects on pancreatic beta cells and insulin sensitivity. Vitamin D deficiency has been linked to a wide field of health problems, including several types of cancer and autoimmune and metabolic diseases such as type 1 diabetes mellitus or type 2 diabetes. More than 30 to 50% of all children and adults are at risk of vitamin D deficiency. Evidence linking vitamin D to insulin resistance and diabetes. Several studies have indicated a relationship between vitamin D status and the risk of diabetes or glucose intolerance. Vitamin D has been proposed to play an important role and to be a risk factor in the development of insulin resistance and the pathogenesis of type 2 diabetes mellitus by affecting either insulin sensitivity or beta cell function or both. So repeatedly, the one factor that is coming into picture is the vitamin D deficiency part. Type 1 diabetes mellitus has also been reported to be associated with vitamin D deficiency based on animal and human observational studies. The prevalence of hypovitaminosis D. Now what is hypo? Hypo is low. As you know, hyper is high and hypo is low. So the prevalence of hypovitaminosis D, that is low level of vitamin D, was found to be higher in diabetic patients. Increasing evidence shows that vitamin D level are also lower in patients with type 1 diabetes mellitus, especially at the onset. So even apart from type 2, even in type 1 diabetes mellitus also vitamin D level are lower. Effects of vitamin D on insulin resistance. Vitamin D may have a beneficial effect on improving pancreatic beta cell function. Remember, this is the very important part of it. Beta cells are embedded in the pancreas and they produce the required insulin. So vitamin D have or may have a beneficial effect on improving pancreatic beta cell function, decreasing insulin resistance, and improving systemic inflammation. Now this is a pictorial representation of what can be caused by vitamin D deficiency. Like it can lead to insulin resistance, beta cell destruction, leading to worsening of diabetes and diabetes. Several studies support a role of vitamin D in pancreatic B cell function through direct and indirect effects. The direct effect is where vitamin D binds directly to the vitamin D receptors. The indirect effect may be via its important and well-recognized role of regulating extracellular calcium and calcium flux through beta cells. Insulin resistance, we have understood it already. Inflammation, again, systemic inflammation has been linked primarily to insulin resistance. Now, in systemic inflammation, when you have some inflammation within the body, for example, atherosclerosis or coronary artery diseases, maybe bronchitis, you name many of the disease, basic reason is inflammation within the system. So systemic inflammation has been linked primarily to insulin resistance again. Vitamin D may improve insulin sensitivity and promote beta cell survival by directly modulating the generation and effects of cytokines. So beta cell survival again can be ensured by vitamin D to improve insulin sensitivity. The mainstay management for vitamin D deficiency is vitamin D supplementation to prevent or ameliorate the disease. So the conclusion here comes that vitamin D deficiency has to be covered up by vitamin D supplementation to prevent the disease. Several studies support that vitamin D supplementation may affect glucose homeostasis, that is, change or improve insulin resistance. Restoration of vitamin D levels was shown to ameliorate glucose tolerance in a study on one hypocalcemic woman with vitamin D deficiency. What is hypocalcemia? Again, as I said, hypo is low. So low calcium level also can be caused by vitamin D deficiency. A significant increase in serum calcium level and a reduction in serum free fatty acid levels have been found after taking vitamin D supplementation. Now mark this sentence. A significant increase in serum calcium. What is serum then? Serum is the liquid part of the blood. A significant increase in serum calcium level and a reduction in serum free fatty acid levels have been found after taking vitamin D supplementation. Recently, a New Zealand study found that South Asian women with insulin resistance improved markedly after taking vitamin D supplements. Now coming to the question which everybody must know or must think, what is my vitamin D level? Because vitamin D is not only responsible for causing what is called diabetes, deficiency of vitamin D, but it can lead to many other complications. So obviously, everybody must have this query in your mind, what is my vitamin D level? Well, you may get it checked by your local path lab in consultation with your doctor. However, what is the level? What should be the level? Now, below 10 nanogram per ml of vitamin D states it's a severe deficiency of vitamin D in you. The interval of 10 to 24 nanogram per ml, it is interpreted as mild to moderate deficiency of vitamin D. The level of 25 to 80 nanogram per ml is the optimal level. However, more than 80 nanogram per ml is the toxic level. In fact, hypervitaminosis can also be toxic to your body. And a vitamin D level of more than 80 nanogram per ml will be toxic again. You can get it measured, and in case you have deficiency, there are good medicinal vitamin D supplementation available which your doctor may prescribe to you if required. In addition, you can get vitamin D from sunlight and from normal dietary sources. Now these are the sources for vitamin D supplementation, like cod liver oil, caviar, mackerel, salmon, sardines, tuna, mushrooms, raw milk, and eggs. But to top it all, sunlight is the best provider for vitamin D in your system. This is the blood sugar chart which everybody will be knowing or maybe interested to know. Now, before I go to the fasting and postprandial level, what is HbA1c? HbA1c is a test nowadays dependent by the doctors, or have high confidence for the medical fraternity on this test, which actually gives the figure of an average blood sugar level for the last 3 months or maybe 90 days. So this makes the doctor to conclude about your health status or about your sugar status in a better way. But however, the chart here it is that if you are non-diabetic, if you are normal, then your fasting blood glucose reading. What is fasting? If you are in fasting for 8 hours without any food, then like early in the morning, if you take your blood sugar reading, if it is within 80 to 100, then it's considered to be normal. After eating, the normal blood sugar level uh, has to be between 170 to 200. And postprandial, what is called after eating 2-3 hours, the normal level is 120 to 140. Impaired glucose, if you remember, I referred to a term called pre-diabetes. So that is called impaired glucose. Now, in case of impaired glucose, the level, fasting level is considered to be 101 and 125. After eating, it is considered to be between 190 to 230. And after 2-3 hours after eating, it is considered to be 140 to 160. If these are the levels, then you have impaired glucose level, a matter of concern because you are proceeding towards getting diabetes. And in case of a recognized diabetic patient or a declared diabetic patient, the fasting level will be 126 plus. After eating, it can be somewhere between 220 to 300, and after 2-3 hours of eating, that is postprandial, it can be 200 plus. Now this is a chart which should be known by people who are already diabetic or pre-diabetic or for general knowledge purpose also. Now, commonly referred terms in diabetes mellitus. When you consult a doctor, so many terms are either mentioned in the prescription or referred to your pathological laboratory, or sometimes the doctor discusses. So, just for your information and knowledge, what are the common terms referred to diabetic mellitus? Blood glucose, also called blood sugar, the main source of energy that food is turned into, that's found in the blood. Blood glucose level. The difference is blood glucose is blood sugar, but what is the blood sugar level or blood glucose level? The amount of blood glucose at a specific time in your system or in your serum. FBS, that is called fasting blood glucose. Fasting blood glucose measures blood glucose after you have not eaten for at least 8 hours, and the reading should be between 80 to 99 mg per dl. PP, postprandial sugar test or PP test, measures blood sugar level after 2 hours of eating, and that should be normally between 170 to 200 mg per dl. RBS, you must have heard the term if you are a diabetic patient or not, then you can just get the information here from RBS. It is called random blood sugar, measures blood glucose regardless of when you last ate. Means at any point of time, a non-planned blood sugar testing, neither it is fasting blood sugar nor it is postprandial. It can be called random blood sugar. What is HbA1c I was just referring to, that is glycated hemoglobin, a blood test that reflects your average blood glucose level over the past 3 months, and that is nowadays what is dependent upon. For people without diabetes, the normal range for the HbA1c level or hemoglobin A1c level is between 4% and 5 to 6%. That is a normal range. A person who is non-diabetic, a normal healthy person. Hemoglobin A1c or HbA1c level between 5.7 and 6.4% mean you have pre-diabetes and a higher chance of getting diabetes. Means you are approaching towards diabetic. Level 6.5 or higher means you are already diabetic. So if your HbA1c test level comes out to be 6.5% or high, that means you are already diabetic. If it is between 5.7 to 6.4%, you are pre-diabetic. You are not yet diabetic, but you are approaching to get diabetes first. And if it's between 4 to 5.6%, you are a normal healthy person. And HbA1c, I repeat, is glucose level over the past 3 months. Then comes NIDDM. NIDDM is non-insulin dependent diabetes mellitus. That is a diabetic patient who is not on insulin supplementation yet. That is called non-insulin dependent diabetes mellitus. IDDM, that is insulin dependent diabetes mellitus. People who are on insulin. Now, autoimmune disease I have already explained. However, once again, disorder of the body's immune system in which the immune system mistakenly attacks and destroys body tissue itself that is believed to be foreign. So when your body becomes allergic to your own body parts, some of your own body parts, and starts destroying or killing those body parts, that is called autoimmune disease. As I said, one of the examples for autoimmune disease can be a rheumatoid arthritis. Diabetic retinopathy, a type of diabetic eye disease, damage to the small blood vessels in the retina, loss of vision may result. That's really a very highly dangerous situation to have diabetic retinopathy. It can lead even to blindness. Diabetic neuropathy. This is a type of nerve damage that can occur if you have diabetes. High blood sugar can injure nerves throughout the body. Diabetic neuropathy most often damages nerves in the legs and feet. Many times, patients feel pinprick sensation, diabetic patient, in their feet or other parts of the body. Now that is suggestive of having diabetic neuropathy. Glycemic index, many times you must have come across this name. Glycemic index is a ranking of carbohydrate containing foods based on the food's effect on blood glucose compared with the standard reference food. So many times diabetic patients actually tries to know the glycemic index of any food material before consuming it. Hyperglycemia, that is high blood glucose or high blood sugar. Now, if doctor says you are suffering from hypoglycemia, what is hypo? Hyper, if it is more, hypo is less or low. Hypoglycemia, therefore, is low blood glucose or blood sugar, is a condition that occurs when one's blood glucose is lower than their target, usually less than 70 mg per deciliter. Immune system, the body's system for protecting itself from viruses and bacteria or any foreign substances. When you are diabetic, your immune system gets compromised actually. Impaired glucose tolerance, a previous term for pre-diabetes found when using an oral glucose tolerance test. Impaired glucose tolerance, as I have narrated already, is something which is connected to pre-diabetes. Insulin. Insulin is a hormone. I was discussing all through my slides. Insulin is the hormone that helps the body use glucose for energy. When needed, it is taken to manage blood glucose or blood sugar. Insulin analogs. This is a very latest concept that has come internationally. An insulin analog is a tailored form of insulin in which certain amino acids in the insulin molecule have been modified. The analog acts in the same way as the original insulin, but with some beneficial differences for people with diabetes. Analogs are sometimes referred to as designer insulin. Insulin resistance, the body's inability to respond to and use the insulin it produces. This is a very important term, insulin resistance, because almost all the diabetic patient has insulin resistance. Ketonuria, a condition occurring when the ketones are present in the urine, a warning sign of diabetic ketoacidosis, which is very, very alarming and can lead to death also. Now, coming to the last slide, I always end by saying that laughter is the best medicine and which is free. Now, I also name it seriously lighter moment. So today's laughter dose insertion is that was for you to read and interpret and have your laughter dose. Thanks for watching. Hope this educational info is useful to you. If you find pieces of information useful, then do subscribe to this channel, like and forward. You can also suggest any topic you'd like me to throw light on. Do write your opinion in the comment section. Thank you and see you